Welcome to This Week Health Conference. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels and events dedicated to leveraging the power of community to propel healthcare forward. Today, we have an interview in action from the fall conferences on the West Coast. Here we go.
Hello, I am Sarah Richardson with Tivity Health. I'm their SVP and Chief Digital Information Officer, and I am fortunate enough today to be joined by Heather Nelson from Boston Children's and Barb Casey from Pixel Health. Ladies, thank you for being here today.
Thank you for having us.
Thank you.
Yes, so in all the times we have to connect, I ran into Barb last night and I was like, what is new and wonderful? And she's like, oh my gosh, I cannot wait to tell you what I'm doing with Heather. So please share with us all the amazing, and especially you have a really innovative project going on at Boston Children's, which from what I understand is the absolute first of its kind.
Yeah, so we have partnered with Pixel Health and T-Mobile as part of our clinical mobility strategy to implement the first of its kind in healthcare, a private 5G cellular network, which is really going to put us on the map, but more importantly, bring the consistency that we need for our clinicians, our care teams, our physicians when providing the care that they do with the devices that they need.
Yep. So it's all about connectivity. And,
Yes.
And heretofore, it's been pretty tough to make this connectivity happen in healthcare, right?
It is, and we can't rely on Wi-Fi anymore, solely on Wi-Fi. So this, having a cellular environment that we can rely on, that is consistent with Wi-Fi there just in case, is a game changer.
This is all about reducing clinician burden and allowing opportunities for them to spend more time at the bedside with the patient, which we hear about a lot, and it can be tougher to get these initiatives implemented in our facilities. What was the genesis of this and how did you make it happen?
Oh, sheer will. At Boston Children's, we're also getting ready to implement our new EHR, Enterprise EHR, in June of next year. And at the time, as we were selecting and moving forward, we knew that we needed to reboot our clinical mobility strategy because our physicians, our care team members are all over. It's not just in the four walls of the hospital. I needed to be able to say, I need a technology, I need solutions that I can scale and that can grow with the organization, both inside the four walls, but more importantly outside, because we serve a community. And so in partnership with Pixel Health, they said, yes, let's do this. And T-Mobile was the one that raised their hand and said, we want to do this. And we've learned along the way. I mean, we're creating the playbook, we're creating the roadmap for this, and that's what's so exciting.
So Barb, you have a storied career in healthcare, and you've done so many amazing and exciting things. What about this for you is such a hallmark in what you're delivering for members of CHIME?
Oh, I feel like this is a lot of the things that I've done in my career coming together in a crescendo moment. We're all talking about staff and workforce issues, and hopefully this kind of a solution will contribute to just sheer satisfaction at work for nurses and doctors and the care team, because we're really trying to optimize their experience. And then it's also about that infrastructure, the connectivity, how all the alarms, alerts, and communications happen in the background using lots of different systems. I mean, this is an ecosystem that really makes this work. And so we're fortunate to have done a lot of that, and if I passed and then my team's passed, and so we're very good, I think, at connecting all those dots. And so we're just thrilled to be working with Heather and her team to make this happen at Boston Children's.
So you're laying the foundation for other stuff to come.
Yes.
I mean, you've got the EHR implementation, you've got this implementation. Like, what does it mean for 24 and beyond for you?
One is just getting us standardized and getting us to a place, in essence, bringing us to the 21st century from a technology perspective, eliminating the duplication, the friction that sometimes IT can be known for, and really bringing a foundation that we can build upon and we can grow with. And again, not just within the four walls. All of us, all health systems are thinking about partnerships in their areas, but more importantly, outside, virtual care, international. I mean, we all have international patients. How do we serve those in a way that's easy, consistent, and secure? And so that's what we're looking forward to. I have to, from a CIO perspective and IT perspective, I need to ensure that our technologies are at the same level of our clinical excellence at Boston Children's. And this is totally affording us to be able to match that so I can continue to support the clinical excellence that happens for our patients at Boston Children's.
So are you two going to go for the Innovator Award or the Collaboration Award for next year's Fall Forum?
Both.
Oh, both.
Guaranteed to get potentially one out of
Yes, and I love
that.
We'll
Saw
look
Terry
forward to that.
About
Yeah.
to win today, and so just the continuation and power of the women in CHIME and the partnerships we form. So I have to ask as a closing question. We're a day and a half into Fall Forum this year. What are you loving about Fall Forum this year?
I just love the networking. Yes, the sessions are great, but I love to be able to sit down for 5 minutes and catch up and ask questions. The focus groups are great because we learn from each other, but for me, it's just catching up with colleagues and just learning from each other.
Yeah, I was going to say the connections and learning from my colleagues and meeting new people. It's been wonderful to have this forum to be able to meet new people, not only CIOs and
Yeah.
those folks, but also from the foundation membership as
Yes.
well.
Well,
Yeah.
thank you both for taking time
Yeah,
today.
thank
you.
Congratulations on your partnership and amazing things you're doing, and I can't
Thank
wait
you.
as next year's follow-up to hear all about it. And ideally, we're
Absolutely.
celebrating additional successes.
Yes.
Yes,
Thanks
women in
again.
healthcare.
Thank
Yeah.
you.
All right.
Thank you, Sarah.
Thank you, Sarah.
Another great interview. I want to thank everybody who spent time with us at the conference. I love hearing from people on the front lines. It is phenomenal that you shared your wisdom and experience with the community, and we greatly appreciate it. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. They are CDW, Rubrik, Sectra, and Trellix. Thanks for listening. That's all for now.